Doctor, can you tell us what the difference is between something that's acute or chronic when it comes to back pain?
So in general, when we're referring to acute back pain, we're talking about something that's been present for 6 weeks or less. And chronic back pain is generally more than 12 weeks. And then there's sort of that middle ground of subacute, where it's between about a month and a half and 3 months.
Gotcha. And is the treatment plan similar to both?
Well, it would be similar if you had somebody who came in with subacute or chronic back pain that had not undergone any treatment. But if you have someone that's had back pain for about a month and a half and they haven't done anything, if it's not gotten worse, I would still generally start them off with the conservative measures. If there was any reason to believe that they do have a more complicated problem, then we wouldn't necessarily have them wait the 4 to 6 weeks before getting the imaging. We might initiate workup at that point.
Gotcha. So in general, not necessarily, an acute pain can turn into a chronic pain at some point if not treated correctly at that moment. Is that a common thing?
It's actually quite common, and it's really related to how we tend to deal with pain. If something hurts, we tend to not move. We tend to try to protect that area. And what happens very often with the back is you have a sprain or a strain, and it hurts to move, so we move a little bit less, and then we get stiffer. And then we try to move, and that hurts, so we become stiffer. And eventually people will come in and say, my gosh, I can't bend over more than a few inches because when I do, my back hurts. And that's really a decompensation. So the injury may have been relatively mild, but the degree to which they've gotten worse and has been related to their lack of activity, the lack of movement, and then it does go from being a relatively straightforward, simple acute back pain to something which can take a bit longer to recover from.